Hello radiographers, welcome to the second part of the multi-parametric MRI of prostate tutorial. So right now the diffusion scan is scanning, and this is a T2 axial, and I am filming now T2 axial film, preparing T2 axial, and the film layout is 4:5, including the reference image. The 20 images have been set in the film, and remove the reference image from the segments and adjust the zoom and contrast of the images. So as this is a prostate MRI, you have to enlarge the prostate to show it clearly. So if bladder is filled with urine, it's good to fill the bladder with urine before the procedure, because sometimes the prostate enlarged so much then push the bladder and protrude into the bladder. If the bladder is empty, it will not appear properly. And this is the frequency adjustment for MRS. So I will select the peak here, the peak frequency, and then apply. So as I adjust the MRS protocol in previous tutorial, so MRS protocol takes time to be prepared, to be scanned, and after a few minutes it requests adjustment, frequency adjustment manually. And this is the diffusion protocol. You can see the diffusion images in various B values. So I have select the B1000 value diffusion for printing, and now I am in the filming, and I choose 4:6 layout so that I can print 24 diffusion images. You can see that the prostate at the mid area appears bright in the diffusion. So some part of the prostate is more brighter because of the cancerous lesions. You can see that the MRS protocol is running CSI 3D AC prostate number 9. So as the MRS protocol finished, I opened the spectroscopy app application, and from the patient browser I will drag the MRS protocol to the spectroscopy application, and this is the CSI 3D prostate MRS sequence, and drag it to the spectroscopy, and you can see that a graph is appeared in the top left corner, and I will select the pixel from the prostate. So I am selecting the proper image for MRS, proper action slice for MRS, and the proper graph, that in which graph the citrate appear in peak. So in this graph you can see that citrate is peak in the graph. This is the citrate in prostate cancer. The citrate appears in the peak. A tall graph appears for the citrate. So I am choosing different pixel in different position of the prostate, and then select save the graph, and now open the table for this graph, and select cited for the ratio, that other chemicals, other metabolites will compare with the cited. So cited ratio will be 1, and click OK, and then save the table. And then select another pixel in another area of the prostate, and see the graph where the in the graph cited is peak, and then save the graph, and open the table, and again save the table for this pixel. So this is the second pixel that I choose for MRS, and then select another area or another pixel from the voxel, from the matrix, and then save this graph for this pixel, and open the table for this graph, select cited, and save the table, and then select another area inside the prostate, and see the graph where the graph looks good with cited peak, and you can remove the voxel, remove the matrix, so only there remains the field of view and the one selected pixel. So this is good to see the pixel clearly, and select one and save the graph, and also save the table for this pixel. And I am searching for another area where a lesion is more black and it seems to be cancerous tissue, and then you can see that there is also the cited is peak, and save the graph and save the table. So select 4 to 5 pixel inside the prostate, and select and save the graphs and table. So this is the technique for MRS. So here is a lesion, here is the lesion, you can see in the middle of the prostate. So I am again select a area from this, and save the graph and table chart for this area. And now close the patient from the spectroscopy app. So now it's time to print the MRS images. So select one graph and one table for each pixel, and send to the filming. So I am doing so. I am sending a graph and a table with the reference pixel, and I moved out the patient to inject the contrast, and the contrast is now given. So I am selecting the MRS images and sending to the filming. For each pixel, there is one graph and one table. So keep in mind that when you select a pixel inside the poster, you have to save one graph and one table chart, where the chart will include the cited, the quoted, and the creating. So I have to select carefully the images, MRS images. So now it's time to adjust the post contrast protocols as the contrast is given. So for multiparametric MRI posted, the rule is to take a dynamic contrast enhancement protocol for posted, but in this case I didn't take it as the consulting with the radiologist. But in routine case you have to take the dynamic protocol for contrast, but here I took the normal fat set sequences for post contrast. So now I am planning for the post contrast T1 transverse fat set and planning on the sagittal image, and these are the localizers as the main photo sequences T2 cells or T2 coronal didn't go to the exam card, so I have no choice but selecting the localizers. So T1 transverse fat set post contrast have been planned and applied. So I have to press the continue button, play button to start the scan. And now I am planning for T1 coronal fat set. You can see the planning on the sagittal image and the slice thickness is 3. And I append the protocol, coronal fat set protocol, to make a sagittal one. For this, change the orientation to sagittal and plan on the coronal and axial image for sagittal and click apply. So again go to the MRS. So I was selecting the MRS images and sending to the filming to prepare a MRS film. So now I am in filming. So I will change the film layout to 3 into 5 so that 15 MRS images will fit in the film. You can see that each column, sorry, each row contains 3 images. One is the pixel, selected pixel, and the one is graph and one is table. So my T1 transverse fat set post contrast is running. So you have to take the dynamic post contrast for multiparametric posted. So this is the T1 fat set transverse post contrast that I am scrolling. You can see that inside the posted there is some lesion that is hyper intense, enhanced with the contrast. So you can double click the segment to see in one segment. So there is a bright lesion, bright signal inside the posted that will be a hemorrhage. So I'm giving measurement of the posted using the measurement tools. So this is the height and width of the posted, 3.5 centimeter and 2.58 centimeter, and then select the series and send it to the filming. And in the filming For T1 transverse fat set, I will delete some images from start and from the end, and the layout is 4 into 5. 20 images will fit in the film including the reference image, and for posted, enlarge the image and show the posted clearly and adjust the contrast. So posted lies just below the urinary bladder where urethra starts, and it's a very important organ for the male reproductive or male urinary tract. And actually prostate is a one kind of gland. It's a mixed gland and very important one. So this is the T1 fat set coronal, and I will again give the measurement in this view. The width is 3.38 centimeter and the length is, so let's drag again the line. So again I am in the filming the coronal images, and the layout is 4 into 5, and delete the rest of the image and remove the reference image from the segments and enlarge it a little bit and then print out. And another one is remaining T1 sagittal fat set that is scanning right now. So I forget to change the name of the protocol. It's still T1 coronal fat set, but actually it is T1 sagittal fat set that I changed the orientation but didn't rename it. That's the T1 sagittal fat set post contrast. You can see that I am scrolling the viewing card. So in this view, I will again draw a line, measurement line, and it will help the radiologist for report. And then select series and send it to the filming. And adjust the contrast of the image and also the zoom. Slightly zoom in the image so that the prostate and the bladder appears perfectly. Actually, it's a bad habit. I always keep zoom in and zoom out the images as long as I am not satisfied, and slightly darken the image and pan the image so that the prostate is in center position. So I satisfied at least and print out. So thanks for watching. Please subscribe my channel.